Are you a pitcher that's having pain in the back of your shoulder, right around here, every time that you reach to get into layback, and you're just not sure what's going on? You're getting frustrated that you can't throw without pain. I'm going to talk to you today about what's called internal impingement. So we're going to go over what it is, how it typically presents in throwing athletes, but especially pitchers, and really what rehab looks like for this injury. How do I know this? My name is Dr. Jeff Lewis. I'm the owner and physical therapist of Lewis Physical Therapy and Sports Rehab in Point Pleasant, New Jersey, where I have helped countless baseball players get back to throwing pain-free, get stronger, and throw harder. Internal impingement. What I want to preface this video with is the difference between internal impingement and external impingement. External impingement is what we commonly talk about for pain that can be sometimes on the front or the side of the shoulder, and that's usually going to involve structures such as your long head of the bicep tendon, subacromial bursa, the supraspinatus tendon, which is one of your rotator cuff. And again, that is going to be more so common in throwers. That one of the reasons that throwers can have pain along the front of their shoulder or the front to side of their shoulder. Internal impingement literally means internal as in the joint. So again, the shoulder is a ball and socket joint, and we want to think about a golf ball on a tee essentially. Internal impingement is when a pitcher gets into maximum layback. And again, for me, you can see I don't have great external rotation. I've stretched guys before where their forearm can get pretty much parallel to the ground, so they have a ton of external rotation in that shoulder. When that shoulder gets into layback for these individuals with internal impingement, they are going to feel literally a pinch or pain right in that joint line. So almost like if you were to find the seam of a t-shirt you're wearing, it's pretty much right on that spot right there. When they are reaching back into layback, that's where they feel that pain and that pinching. That is one of the most common signs when I listen for when someone is describing the type of pain that they are having in their shoulder. So what is internal impingement? It literally is when that arm is going into layback, the rotator cuff tendons and or part of the labrum in the back of the shoulder there is literally getting pinched between the golf ball and the tee. So getting pinched between the humeral head and the glenoid that it rotates in. And that's what's happening at maximum layback in these individuals. Most commonly, this is because that humerus is usually sitting forward in the socket, and as a result, when it goes back like that, the angle of the arm that it creates is leading to that pinching of the rotator cuff or the labrum. In a lot of these cases, you might also have, and I will say depending on the severity of it, you might also have actual rotator cuff injury symptoms. So it's one thing we want to be mindful of, where for rotator cuff injuries and issues, pitchers are more likely going to be describing pain at the follow-through and release and follow-through part of the throw because of the traction and eccentric forces placed on the rotator cuff during that part of throwing, versus internal impingement is going to be more specific to in layback they feel it. Can pitchers with internal impingement have pain in other phases of throwing? They certainly can. Everyone presents differently, but that's just one of the common hallmark differences between true rotator cuff pathology and internal impingement with some rotator cuff or labrum involvement, okay? So that's a lot of the difference there in terms of how we look at pain location and the painful phase of throwing. Big part of that process that I use to help determine what's going on more than anything, all right? So from a rehab standpoint, what does a rehab look like? First and foremost, we want to get range of motion back. More often than not, these guys do not have good posterior capsule rotator cuff mobility. So what I'll do, I'll literally block their shoulder blade and pull their arm across their body. We want to see that elbow get very close to in line with almost their chin and their nose as they're coming across here. A lot of guys will just get to here and that's it. So as a result, when they don't have the mobility throughout the back of that shoulder is naturally going to sit a lot more forward and just further lead to more pinching of those tendons and labrum as they get into maximum layback. So range of motion is a big thing. Rotator cuff strength and endurance is another big part. The job of that rotator cuff is to keep that shoulder or the golf ball centered in that shoulder in the tee the entire time. The next part of that is going to be scapular strength and awareness. The scapula is the shelf that our shoulder rotates on. So just like a shelf in your cabinet, if you put a lot of stuff on that shelf and that shelf is not stable, it's going to come crashing down. Something's going to happen. We're just not going to support it. Same thing with that scapula in terms of your shoulder. If you are not strong and stable there, well, where are you going to have to get most of your motion from? Your shoulder. You get too much motion through the shoulder without support. Boom, you're going to end up getting some pressure on other structures, which in this case can very commonly lead to that internal impingement. Next thing is identifying any issues throughout the kinetic chain, and then kind of taking a look into throwing biomechanics as well. A lot of times guys that are what we call hyper abductors, where when they're going to throw, and if you're looking at front foot strike, if their elbow is way far behind the plane of their body there, that is going to naturally predispose them to be in that maximum or higher contact between the or in compression on the rotator cuff and the labrum. So that's how throwing mechanics can play a little bit of a role into this. Again, it's different for each person, but we want to look at thoracic spine rotation, hip strength, really looking at everything along there that's just trying to paint a better picture of why is all this stress going through that shoulder. So if you're a baseball player, especially a pitcher, and you've been dealing with just that pain or pinching right in the back of the shoulder, and it's getting worse over the past couple weeks or months, it hasn't gotten better or it hasn't gone away, you have questions about why this is happening, leave a comment below, or you can reach out to us at the number directly below, and we'll get back to you on how we can help out with a personal, individualized plan.